All right, so we're going to pick up where we left off, facial bones. So once again, facial bones, know your facial bones. How many in total, which ones are paired, which ones are individual, and then also which ones articulate with which ones, okay? So know that, know which ones make up the eye socket, all of that. So over here, they've got the labels for you. So make sure that you review, you know what you're looking at, you know where it is as far as anatomy. Okay, the mandible. So the body, the ramus, make sure that you are able to label all of this just in case. So A through J is right over here. Review it. This is for your benefit. Temporomandibular joint, the temporomandibular fossa, like we talked about, the condyle, the head, the EAM right here. The temporomandibular joint is the entire thing. So the condyle and the fossa make up the temporomandibular joint. TMJ motion. So with a closed mouth, the condyle sits in that fossa. Open mouth, the condyle comes forward in that fossa, okay? Sometimes with imaging prior, you used to have to image the TMJ with a closed mouth and an open mouth to see the movement within that TMJ. So your orbits, know how they sit, okay? So 30 degrees from the EAM, 37 degrees from midline, so 37 medial angle, 30 degrees superior angle right here. So when you're imaging those orbits, you kind of know how to set them up. Make sure that you review that because they do come along once in a while. Bony composition of orbits. So know what bones make up the orbits, know where they are and what they are, okay? Laid out right here. 3 cranial bones, 4 facial bones. So that's what make up the composition of the orbits. Facial bones, lateral view. Review this. It should all be reviewed. This should be familiar from your summer image critique. And here we have it labeled over here, so make sure that you go through it, go through that PowerPoint, save that PowerPoint, whatever you have to do, go through and label your anatomy. SMV facial bones, review your anatomy. I can't say it enough. Review your anatomy. Parietoacanthial waters. Okay, so our MML is perpendicular to our image receptor. We have a 0-degree central ray. It is forming a 37-degree angle to the image receptor. But more importantly, it is that MML that is perpendicular to the image receptor. Central ray is perpendicular to the image receptor. Exit at acanthion. Okay, so you can see coming right across here, you're exiting at the acanthion into that image receptor. Right here, 0 degrees coming down, exiting the acanthion with that MML perpendicular. Erect Parietoacanthial, it's the same thing. Your horizontal central ray, 37 degrees, OML and IR. MML is perpendicular to the image receptor. So MML is perpendicular to the image receptor. You're coming in here at the back of the skull, and you are exiting the acanthion, okay? So you can do it at the wall, you can do it at the table. Same setup for both of them. Criteria for the parietoacanthial. You want the petrous ridges below the maxillary sinuses. So these petrous ridges here are below the maxillary sinuses, okay? No rotation, optimal exposure factor. So if you make that image and you're not seeing your maxillary sinuses, you are not positioned correctly. You need to adjust your patient. Modified parietoacanthial, modified waters, okay? So if they're not able to get the MML, you can do the LML perpendicular to the image receptor. OML forms a 55-degree angle to the IR. So this is your OML. This is your LML. Central ray perpendicular and exits at the acanthion. So this is if you're doing a modified, it's still exiting the same place. Instead of the mental meatal line, it's the lips meatal line. This is the ideal for projection to demonstrate possible orbital fractures. So knowing your history of your patient and what's going on, this will better assist you in understanding how you should image. Are you going to do the Parietoacanthial waters or the modified waters? Okay. So criteria for the modified waters. You want the petrous ridges projected in the lower third of the maxillary sinuses. So you want your petrous ridges in the maxillary sinuses. You want to visualize your orbit floors not distorted, no rotation, optimal exposure factors. So you're really seeing the orbits really, really good in here. And if you go back to this waters, see how you're not seeing the orbits? So just that small move from the MML to the LML is going to allow you to see the floor of your orbits really, really well, okay? So lateral nasal bones, interpupillary line perpendicular to the film, right there. Central ray perpendicular centered to a 1/2 inch inferior to the nasion. So your nasion's here, just a 1/2 inch inferior. You're going to pick up those nasal bones, okay? So your criteria for your nasal bones, you're going to do a right and a left nasal bone. You're going to do both because you actually have 2 nasal bones, one on either side, and you're going to want to image both sides. Okay, so you're going to do a right and a left. No rotation, optimal exposure factors. SMV zygomatic arches, so you're getting your arches here. Okay, this is a lower technique because with a high technique, you're going to burn out your zygomatic arches. So you want those zygomatic arches well demonstrated, no rotation, optimal exposure factors. It is a lower technique than what you use in the normal skull or what you would use in a normal SMV, okay, because you want to see the arches. Oblique, inferior superior tangential. So you are rotating and tilting the skull 15 degrees towards the affected side. So this is the affected side. So you're going to rotate, and then you're going to tilt, okay? So rotation and then tilt, okay, to get this, this jawbone out away from everything. So you're skimming it. It's the tangential. The IOML is parallel to the film. So IOML, parallel to the film, okay? Central ray is perpendicular to the film and the IOML. So perpendicular to the film, perpendicular to the IOML. Central ray to the arch of interest, okay? So you can see your light field kind of coming up right here, across, okay? So it's to this side of interest. So your criteria, zygomatic arches are well demonstrated. They are demonstrated out here away from the face. You can see that you're not picking up a lot of your anatomy here as far as the mid portion of the skull, the mid portion of the alveolar, the mid portion of the jaw. You're focused on that zygomatic arch, okay? So a really low technique once again. So a low technique because you don't want to burn out those zygomatic arches. AP axial facial bones. AP axial facial bones. We are central ray 30 degrees to OML. Okay, so OML here. OML right here. 30 degrees or 37 to IOML. So if you're IOML or OML, depending on which one you're using, 30 degrees for OML, 37 for IOML. Central ray is 1 inch superior to the glabella. So just 1 inch superior to the glabella. Remember for the skull, we were clear above the glabella, okay? So now we're facial bones. We're not worried about the skull. We're not worried about the top of the skull. That can be clipped off. It's the facial bones we're interested in. So still 30 or 37 degrees. And then keep in mind, you're still going to come down 1 inch for every 5 degrees of rotation, okay? So make sure that you remember that. And it's going to pass through the mid-arches. So this is what they're talking about. Central ray comes down, and it's passing through the mid-arches, okay, of your zygomatic arch. So zygomatic arch is centered for the AP axial, no rotation, optimal exposure factors. So this is almost like a Townes, but it's a lower technique, and you are going to view both of your zygomatic arches really, really well, okay? So low technique. Rhese Oblique. So a Rhese Oblique is for the orbits. Your mid-sagittal plane, 53 degrees to the film, okay? So that head, 53 degrees. So you're putting, what you'll hear a lot of times is nose, cheek, and forehead to the table. So like a 3-point landing. Your central ray is going to be about 37 degrees from the mid-sagittal plane, okay? And you're going to exit the orbit of interest, the orbit next to the image receptor. So AML perpendicular to film, okay? So AML right here, AML perpendicular to film, central ray perpendicular to the downside orbit. So you're back here on the back of the head, coming right down into that orbit, that area of interest, okay? So optic foramen is in the lower outer quadrant. So your optic foramen is in the lower outer quadrant. Optimal exposure factors, and then close collimation. So it's not going to be a circle, it's going to be a square. They don't do the cones anymore. You've got the four-sided collimation, so that's what you're going to use. Mandible now. Axiolateral mandible. So 0 degrees for the ramus. Okay, so coming in here at a 0 degree is for your ramus. 30-degree rotation of the head. Okay, so this head is 30 degrees. That is for the body of the mandible. Central ray is angled 25 degrees cephalad to the interpupillary line. So here's the interpupillary line, 25 degrees cephalad is your angle, okay? Criteria, area of interest demonstrated. So you've got your ramus, your condyle up here, the body of your mandible. You're only viewing one side. You're viewing the side closest to the image receptor, so not the upside, it's the downside. So this one's going to be moved out of the way. This one on the downside is going to be the one that you're imaging, the side closest to the image receptor. So your PA mandible. OML is perpendicular to the film. So the OML, perpendicular to the film. Central ray perpendicular to exit at the lips. So basically, OML, and then set the central ray to exit at the lips. Open your collimation so you get your entire jaw, your entire mandible, okay? This is what you're going to see. You're going to see your condyles, the head of your condyles. You're going to see the ramus, the gonion on either side, and then the body of the mandible coming into the front. So the entire mandible is included and no rotation. AP axial mandible. You have the OML perpendicular to the film, perpendicular to the table. Your central ray is 35 to 40 degrees caudad, okay? So you've got this angle. Central ray is centered to the glabella. So you're right at the glabella with that 35 to 40 degree angle with your OML perpendicular. Condyloid processes are demonstrated. So right in here is really what you're looking at. Those condyles. The head and the condyles are imaged within that AP axial mandible. So it's not the entire mandible. You're focusing on the condyles. The SMV Basically, an SMV is an SMV. When you set up for SMV of the skull, SMV for sinuses, SMV for mandible, that is what you're getting in the entire thing. So entire mandible demonstrated, which you have right here, okay? You just don't want rotation, so no rotation one way or the other, no tilts back and forth. You want a really nice mandible demonstrated in that SMV. So AP Axial TMJ, so this is the TMJ, your central ray level at the TMJs. So it's a little bit above the glabella, but you want to follow this line down to make sure that it's exiting through those TMJs. You're angled 35 degrees caudad, so 35 degrees caudad. OML is perpendicular to the film, so OML, and then that central ray comes down and cuts right through the TMJs. And once again, you're imaging the condyloid processes and the TMJ fossa demonstrated. So you're getting this fossa here, you're getting the TMJs, the fossa over here, and the TMJs. So it's almost similar to the AP Axial Mandible. So this is centered at the glabella. This one is centered to exit at the level of the TMJs, okay? So that line's going to cut through the TMJs, so it's going to be a little bit superior to the glabella, okay? So that's what makes it able to see that fossa for the TMJs. Axiolateral oblique, this is the law method. Okay, so you're going to rotate the face 15 degrees towards the film. So you're rotating 15 degrees towards the film. Your central ray is also angled 15 degrees caudad, okay? And your central ray is 1.5 inches superior to the upside EAM. So 1.5 inches to that upside EAM, okay? And that is the law method. Closed jaw or open jaw. So you're probably going to do both, a closed mouth and an open mouth here. Okay, and that's going to demonstrate those, the fossa, the condyle, the head of the condyle. And that's what you're seeing. So TMJ closest to the film is demonstrated. You're seeing that this is the closed mouth because the condyle is sitting in the fossa. Now we're on the Schuler method. So central ray is angled 25 to 30 degrees caudad, enters a 1/2 inch anterior and 2 inches superior to the upside EAM. So you're going for the EAM, you're going 2 inches superior, but a 1/2 inch anterior, okay? And you're angling 25 to 30 degrees caudad. You don't want any rotation in the head, so the interpupillary line, mid-sagittal plane, make sure that everything is in alignment. Once again, closed mouth, open mouth. So criteria, axiolateral Schuler, closed mouth, you're seeing the fossa, the condyle head, the fossa and the condyle head moved forward in the open mouth, and you are imaging the TMJ closest to the film. So if they want both sides, you're going to have to do a right and a left. So sinuses, 4 groups. This one should be easy. Review your groups, okay? A, B, C, D. Internal divisions of the ear, external, middle, and inner. Make sure that you review your inner ear and your middle ear. What makes up the middle ear? What makes up the inner ear? Do a quick refresh on that. The oval window, the cochlea, the internal acoustic meatus. Make sure that you review this. This is the internal ear, but also go into your book and make a quick review in there. So your mastoid air cells, it's a cross-section of your mastoid air cells. Your aestuation tube, review what your aestuation tube is and what it does. Your styloid process, your mastoid tip, your mastoid air cells right here that we're very familiar with. The antrum, the adductus is in between and lies next to So it's in between the antrum and right before the tympanic recess or the attic, okay? And then you have the tympanic cavity proper, okay? So the way this bone comes up, you've got that narrow place is the additus, okay? Lateral sinuses, central ray midway between the outer canthus and the EAM. So outer canthus, EAM, you're midway in between them, okay? Criteria, all 4 sinuses demonstrated. So you have 1, 2, 3, 4 sinuses demonstrated. It's the only time that you will see all 4 of them demonstrated, okay? PA Caldwell sinuses. OML is perpendicular to the image receptor, okay? So this OML, perpendicular to the image receptor, a 15-degree tilt, okay? So they're tilting the Walbucky here. Horizontal central ray. Central ray is going to exit the nasion, okay? So you can put your OML perpendicular, and then you're going to bring the head up 15 degrees. Or you can put your OML perpendicular and you can tilt the Walbucky 15 degrees, but it's still exiting the nasion, and you still have a horizontal central ray because you don't want to angle your central ray, okay? Don't angle for your sinuses because you're looking for air fluid levels. Frontal sinuses and ethmoid are seen on the Caldwell sinuses, so that's what you're demonstrating, frontal and ethmoid. The petrous ridges in the lower third of the orbits. No rotation, no tilt, okay? So the Caldwell for the sinuses, frontal and ethmoid, and the petrous ridges in the lower third. Parietoacanthial waters, okay? 0 degree central ray, MML to perpendicular to the image receptor, forms a 37 degree OML line, okay? So make sure that they get their chin up there. Central ray and MML are perpendicular, and OML forms that 37 degree, and you're going to exit at the nasion. So the central ray comes through and exits at the nasion. Maxillary sinuses are demonstrated. No rotation of the cranium. Petrous ridges below the maxillary sinuses, right down here. That's when you know you have a really good waters. A waters is a waters is a waters. SMV. SMV is an SMV is an SMV. IOML parallel to the image receptor. IOML parallel to the image receptor. Horizontal ray between the angles of the mandible. Okay, so between the angles of the mandible. Okay, just like that. SMVs, SMV, SMV. Mandibular condyles anterior to petrous ridges. So your petrous ridges are down here. Your condyles are anterior to it. No rotation. Optimal exposure factors. PA transoral waters. So MML is perpendicular to the image receptor, okay, and then open your mouth. So you're going to set up to where the MML is perpendicular, and then you're just going to drop the mouth open. Keep your central ray the same. This still forms a 37 degree angle, and you are still exiting at the acanthion, okay? So a horizontal central ray, just with the open mouth. The transoral, you're going to visualize the sphenoid sinuses. Frontal and maxillary sinuses will also be included. Make sure you have no rotation or tilt. And petrous ridges are below the maxillary sinuses. So they're imaged down here, okay? But you're seeing the sphenoid, maxillary, frontal on the transoral waters. So lateral projection, all 4 sets of sinuses are demonstrated. AP and supro-inferior dimensions of paranasal sinuses, thickness of frontal bone, and detail of side is closest to the image receptor. Your PA axial projection, so this is just a big review. Caldwell method, frontal sinuses above frontal nasal suture, anterior ethmoid air cells, Sphenoid sinuses seen through the nasal fossa below or between the ethmoids. And then the petrous ridges are in the lower third of the orbits. So this is just a review of the projection and then what they demonstrate, okay? Parietoacanthial waters, maxillary sinuses, petrous pyramids lying inferior to the maxillary sinuses. Frontal and ethmoid sinuses are distorted, okay? So your parietoacanthial projection, open mouth waters, sphenoid sinus through the open mouth, maxillary sinuses are seen, and then the petrous pyramids are lying inferior to the maxillary sinuses, just like in the original parietoacanthial projection, the Waters method. So your SMV, sphenoid and ethmoid sinuses. Also, you can see your mandible and your bony nasal septum. So here are some review questions. These are the last of them. What is the central ray angle and direction for the PA axial Caldwell of the cranium? 15 degrees caudad. Which baseline is positioned perpendicular to the image receptor on the lateral projection of the cranium? The interpupillary. If IOML is positioned perpendicular to the IR for the AP axial town projection of the cranium, what is the central ray orientation? 37 degrees caudad. What projection and method are demonstrated? Is it the AP axial town, PA axial Caldwell, PA, or AP? AP axial town. Which projection is demonstrated? We should know that an SMV is an SMV is an SMV. Review question. Which projection is demonstrated? Where are the petrous ridges? PA axial Caldwell, the lower third of the orbits. Which facial bone forms part of the hard palate? The palatine bone. All of the following are parts of the bony orbit except, so know the parts of the bony orbit. All of these are except for one, the vomer bone. What is the central ray orientation for the SMV projection of the zygomatic arches? So, looks like a bunch of perpendiculars and then 15 degrees cephalad. So, central ray SMV projection of the zygomatic arch, perpendicular to the IOML. What is the projection and anatomy of interest? So, PA axial. Is it the mandibular body, mandibular rami? Is it AP axial, the zygomatic arches, or the mandible? It is the zygomatic arches. We can see the zygomatic arches really clear right here, okay? Where does the central ray enter the patient for this projection? Is it the EAM, the sella turcica, the outer canthus, or the zygoma? It is the zygoma. Which projection method is demonstrated in this image? Parietoacanthial modified waters, parietoacanthial waters, AP axial town, or PA axial Caldwell? It is the modified waters. What is the baseline and its position used to obtain the image? MML, AML, OML, OML. Which one do we have? The OML, 55 degrees from the plane of the IR. Which sinuses are best demonstrated on the parietoacanthial projection? The Waters method. The maxillary sinuses, because the petrous ridges are imaged below them. The other sinuses are going to be distorted, so it is the maxillary sinuses. Which sinuses are best demonstrated on the PA axial projection? The Caldwell method. The frontal sinuses. Which sinuses are indicated by the arrow? The frontal. Which sinuses are demonstrated in this projection? Maxillary, frontal, anterior ethmoids. 2 and 3, the frontal and the anterior ethmoids. Review question. This projection is a modification to demonstrate the what? Frontal sinus, maxillary sinuses, anterior ethmoid, sphenoid sinus. The sphenoid sinus. Which of the following facial bones is unpaired? Remember, there's several that are paired. Which one is unpaired? The vomer bone is unpaired. The anterior nasal spine is an aspect of the what bone? The maxillary bone. The palatine process is an aspect of the what bone? The maxillary bone. Lacrimal is derived from a word meaning water, oil, tear, or duct. Tear. Which facial bone forms an aspect of the bony nasal septum? The vomer bone. What is the name of the process of the mandible in which the lower teeth are embedded? The alveolar process. The older term antrum of Highmore describes the what? The maxillary sinuses. So antrum of Highmore, maxillary sinuses. Which paranasal sinus is the last one to develop? The ethmoid is the last paranasal sinus to develop. The posterior aspect of the bony orbit is termed what? So the posterior aspect of the bony orbit is termed the apex. Which of the following bones make up most of the lateral wall of the orbit? So this is when you need to know your orbit. What it makes up, what bones make up the orbit, and which one makes up most of the lateral wall? The zygomatic bone. What passes through the optic foramen? Blood vessels, rectus muscle, retina, optic nerve, optic nerve. And that is it. I will post this. Good luck studying. You guys have got this.